Dr. Sanmi Areola, Director for the Johnson County Department of Health and Environment. We are seeing a bump in cases of the virus that causes COVID-19. It is not an unexpected bump because, number one, we have removed most of the mitigation measures. But number two, we have seen a similar spike in other parts of the world, Asia, Europe, the UK, as well as in other parts of the country. It is driven by a subvariant of the Omicron that we call BA2. We're also picking up those indicators in our wastewater system, indicating that as in the rest of the country, the BA2 is the primary driver of infections. Now, the good news is that we are not seeing a corresponding increases in metrics of hospitalizations, and really reaching out to our hospitals, things are looking really good. What we can do right now is to minimize exposure, especially for those that are at higher risk of more serious consequences. Obviously, you will not get sick if you are not infected. Now, getting infected doesn't necessarily mean that the serious outcomes will happen because of the vaccinations, because we have a fairly high percentage of our residents vaccinated, which is why one of the key things to do is to be sure that you are up to date on your vaccinations. More recently, the Centers for Disease Control and Prevention approved second booster for certain populations, those that are 65 years old or older, and those that are 50 or immunocompromised. And so if you are in those categories, get your booster, be up to date with your vaccinations. Now, that's in terms of preventing the more serious consequences. The vaccines continue to be amazing in preventing serious consequences. Now, the second part of that, which you and I can do a lot about, is to minimize exposure. And some of those basic measures, wearing masks, still continues to be very, very important, protecting yourself and others. Of course, if you test positive, whether it's with an at-home test or other PCR tests, make sure that you stay home if you're sick, and be sure to inform your contacts that you tested positive and they might have been exposed. If we collectively do that, avoid crowded environments, and just take steps, especially for those that are at higher risk of more serious consequences, we can really minimize the impact of this spread.